Welcome back. I'm Tom Martino. You know, it's one health issue that spans every age and gender, your teeth. But choosing the right dentist is tough. We deal a lot with dental health here. You know, you don't want to feel like one person in a herd. You don't want to be embarrassed because you're afraid, right? You know, there's one practice in the metro area that I love. I've gotten to know Dr. Jim Craig, and I'll tell you what I love about this practice, Summerbrook Dental, is that they cater to cowards. And you know, it's all right if you say I'm a little nervous. In fact, Dr. Craig's with us, and we have Yvonne with us, an employee, the first line of defense you call Yvonne, which means she is up front. And when people come in, Yvonne, and I'll just skip right to her if you don't mind.
Yeah, that's great.
Then we'll go back. When people come to you because they're nervous, because we advertise that you cater to cowards, what's the first thing they tell you?
Well, they usually just say, I'm scared to death. I haven't been to the dentist for a while because of my fear. Yeah. And many times they can't tell you why they're frightened, but they just become unnerved when they think of having to walk into a dentist.
And what do you explain to them?
Well, I basically let them know that they're in a situation where the dentists know that they're frightened, and that's, I think, part of their fear.
Right,
that they
exactly.
think no one's going to understand why they're actually frightened.
All right, now, turning dental care into a positive experience. You've done it a lot. How do you do it?
Oh, man. Well, when patients come to our practice, the first thing that we go over with them is you don't have to be afraid. There are a lot of things that we can employ to help you be more comfortable with your treatment. If you're a patient looking for a practice where the dentist just comes in for 2 seconds and says, here's what you need and leaves, it's not us.
You talk to them, you explain what's going on, and let's speak to sedation.
Okay.
What types of sedation? People might think, wait, do I go to sleep? Am I awake? What's going on? You have different levels.
We do, yeah. We have different levels.
Let's talk about the different levels of sedation. I think that's important.
Okay. Well, we have so many fearful patients that we actually have developed a free level of sedation for some of our patients. Patients can take a mild pill and have laughing gas free of charge if they're afraid, because we have so many who are in that category. I just don't feel right charging for that.
Just a mild sedative. So
mild
they're awake, and then they can have laughing gas.
Yep.
But then you can put people out for more serious procedures. They wake up and it's done.
Yeah, we can. In fact, just yesterday we had a patient who wanted to be sedated with just a pill. And during the procedure, she was kind of talking to us. We helped her walk around a little bit for a break at one point, and I thought, she's going to remember this. But I called her that night, no recollection. It worked great.
Yvonne, what do they tell you when they're done and they're walking out? Because you see them coming in, you see them leaving. What do they tell you?
Well, we usually ask them how they're feeling, and they feel great. You know, many times they almost act a little childlike. They're waving goodbye.
They're
and,
happy.
You know, they are just happy.
And you see a lot of repeat clients.
We do, and they come back, and then they're not afraid to come back in. Their experience was just wonderful.
What is the atmosphere like?
The atmosphere in our office is extremely friendly. Really friendly. We're all very positive, and you know, the doctors, Dr. Craig and Dr. Harmon, encourage that. So I think when the patients come in and we're very relaxed about it, it puts them at ease immediately.
You were seeking, if someone was seeking a new dentist, why would you recommend this practice? Other than sedation? That's the main claim? No, it's not.
No, it isn't.
At first I thought, okay, sedation, that's a good marketing hook. But there's way more to it than that. First of all the procedures you do.
Yeah. We do a lot more than just sedation. A lot of patients come to our practice who don't need to be put to sleep, but some people just want to be in a place where they can have all of their dental work done under one roof. We can do root canals. We can do extractions, implants even. We can do dentures. We see kids. A lot of dentists won't see kids.
And that's what's important. You can have one dental practice for your entire family.
Yeah.
And you can do it all. And in the rare cases where they can't, they'll let you know, of course. They're not going to try something they can't do. But and you have the latest technology. That's important.
Yeah, we do. We just have some technology in our practice that's fairly new to us. It's been around for a few years, where you can come in and have a crown made and cemented in the same day. You don't have to have 2 separate appointments.
That's what I love. It's kind of like a lab right there.
Yeah, it is. And for patients who are sedated, then you wake up and the permanent crown is done. You really are finished.
So wait. They go there and the permanent is done in the office. Explain what that is.
Well, it's a computer-generated CAD/CAM system, computer-aided milling design.
So you show them a picture of the real crown, and it mimics that and makes it right there.
That's correct, yeah. With a laser-guided camera, we can take exact pictures.
Computer accuracy.
Yeah. It works great. We have a lot of predictability with that.
And so when they leave with a permanent crown. No more temporary crown and then walking around for 3 weeks hoping it's going to stay on.
Yeah, in most cases, that's exactly how it's done.
Now, we do have some specials. First of all, well, let's talk about the bleaching trays. That's a good one.
Yeah.
Okay, because I think that's cool. Explain that.
Well, for patients who want a teeth whitening, and who doesn't today,
Right.
we'll offer a free teeth whitening to new patients who come and try our practice out.
So if anyone comes, free bleaching trays. It's that simple. With an exam and cleaning. It's free. And you can take them home and use them whenever you want. That's free teeth whitening just for an exam and cleaning. Or you can get a free x-ray and free exam and free consultation. So if you don't need the bleaching trays, you mean to tell me that a new patient can get a free exam, free x-ray, and a consultation?
That's right, and in fact, not just one x-ray, but all the x-rays that you need as a new patient. In some cases, it's 8 or 10 x-rays, however many.
If you're looking for a dentist, you have absolutely nothing to lose here, because you're talking about a free exam, a free initial exam, free x-rays and consultation. So you'll know exactly where you stand. You'll know if you like the dental practice, and you will not have to spend a dime to do that. The number, 303-693-1215, 303-693-1215, or online at summerbrookdental.com, summerbrookdental.com. Now, when they call that number, 303-693-1215, will they talk to Yvonne or someone else?
They might talk to Yvonne, yeah. It could be Yvonne or someone else, but we can probably even get them in today.
Yeah, you can even get them in today. So free exam, free x-rays, free consultation, 693-1215. Thank you very much for being here.